This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.
At the moment, we turn to matters of health, where the federal government has announced plans to set up over 8,000 primary healthcare centers across the country under the recently announced Comprehensive Health Sector Renewal Investment Initiative. The announcement was made by Vice President Kashim Shettima at the commissioning of the Suleiman Adebola Adegunwa Trauma Center at the Olabisi Onabanjo University Teaching Hospital in Shagamu. Joining the conversation this morning is Dr. Blossom Maduafokwa, who is a public health practitioner. Doctor, good morning, and thank you for joining us on the conversation.
Good morning. Thank you so much for having me.
Right. Doctor, what are your first thoughts hearing the numbers of PHCs planned for this setup?
Okay, so thank you. So when I heard the numbers, I said that's really ambitious. It would be fantastic if we were to have almost 10,000 more primary health centers across the country. We do know that primary health care is one of the ways or the means for achieving universal health coverage, particularly for a low-income country like Nigeria. So that is a laudable ambition.
So, Doctor, what's interesting is that I believe we've got somewhere, the Ministry of Health in a 2019 register had said that we had about 34,000 plus existing primary healthcare centers. And we already know that a lot of them are in a state of disrepair and don't even have the manpower or even the equipment needed to even qualify as a primary healthcare center in the first place. Is this the point where we have the same debate? We have a similar debate in education where we say tackle the existing ones before adding new institutions. Does that debate count for these primary healthcare centers as well?
So it does count because when we speak about the health system, according to the World Health Organization, the health system has 6 building blocks. So infrastructure is just one of them. So like the buildings, etc. That's just one of them. Other building blocks include human resources for health, which is the healthcare workers that will actually man those primary health centers. And we do know that right now, I think we're about 1 doctor to about 10,000 individuals in Nigeria, as opposed to the 1 to 600 recommended by the World Health Organization. So we do have a human resources for health problem. A lot of our doctors are nurses, even other healthcare professionals are leaving the country in droves. So we don't even have enough people to man the PhD that we have. In addition, another building block is funding. We know that from the Abuja Declaration of 2001, 15% GDP is recommended to be allocated to health, but I think Nigeria usually hovers around 4 to 6%. So funding is also something that is a building block that is currently weak. So it's not just the infrastructure. We have a funding problem. We have a human resources for health problem. We lack amenities, materials to even function in those PhDs. So these are some of the issues that we need to tackle even before we add on more PhDs to our current roster.
There's questions on how we're able to tackle that. So for the funding side, we know that it's about budgetary allocations and the need for the federal government and the state government to prioritize health whenever budgets are put together every year. But I'm also thinking of the manpower, right? You talked about the 1 doctor to 10,000 patients. And I just want to reel out some numbers very quickly, or just analyze the numbers we have already. At over 34,000 existing primary healthcare centers, we're talking if each local government had an equal number, right? We're talking about 44 existing PHCs across the 774 local government areas. By the time we add this nearly 9,000, we want to add an extra 11 to each of these local government areas. Now, I'm thinking of our current, not just in terms of numbers, capacity of medical staff, but also the number of staff. Just, we're not talking capacity now, just the number that are churned out into the healthcare system every year. What do you think we need to start to prioritize if we want to be able to meet up the human capacity to fill these existing centers and the coming ones?
Okay, so that's a great question. So for human resources for health, there are certain things that we have to start getting creative, because to start with, we don't have enough medical schools or nursing schools to graduate enough doctors to serve our population, right? So there are certain things that government has actually tried to do in the past. One of the things they tried to do, they actually tried to bring back retired midwives, retired nurses, bring them back into the health system. So that's one way to beef up the numbers. Another interesting thing that we can do and that we have done at some kind of scale is what we call task shifting. So basically that means the job that I'm supposed to do as a doctor, I can train a nurse or a community health officer or a community health extension worker to do those same jobs. That way, it definitely is easier and a lot more efficient to train, say, a community health officer, for example, or a nurse, than to train a doctor. So if we're able to shift some of the duties that doctors do to some of those cadre of workers, we're able to serve more people that way, particularly in rural communities, remote communities where lots of doctors don't want to go. So that's these are some of the strategies that can be scaled up, but these things need a lot of attention and a lot of investment.
Dr. Madua Fokwa, thank you very much for your time and expertise on this conversation. Dr. Blossom Madua Fokwa is a public health practitioner who joined us this morning to speak on the federal government's announcement of its plans to set up over 8,000 primary healthcare centers across the country. Now, this plan is under the recently announced Comprehensive Health Sector Renewal Investment Initiative. You're still listening to Radio Now 95.3 FM Lagos. We urge you to stay tuned to your Beyond the News station. The conversations continue in just a moment.
We are intentional about the stories we tell and the language we use in telling them.
Intentional about the people we speak to and why we speak to them.
Because here at Radio Now 95.3 FM, we aren't just telling any story.
We are telling you.
This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.